Authorities say about 10% of the medicines in the country are fake. Doctors say consuming these fake medicines may have serious consequences to one's health. Trisha Terada has more.
Anyone could fall into the trap of buying fake medicines that are openly sold in the market, even online. The father of Dr. Maria Minerva Kalimag, for one, suffered from gouty arthritis. A friend recommended to him a Chinese medicine said to contain snake bones to ease the symptoms of the disease. While it temporarily relieved her father's pain, complications came out eventually.
Ang tatay ko po nagkaroon ng diabetes, nagkaroon ng mga multiple fractures secondary to steroid use, nag-shut down po ang kanyang adrenal glands.
The Intellectual Property Office and the Food and Drug Administration say the spread of counterfeit drugs is alarming. The Health Department estimates almost 10% of medicines in the country are fake. When consumed, doctors say possible consequences include failure of therapy, direct harm to patient, and resistance to drugs.
So halimbawa meron siyang infection, hindi siya gagaling, lalala ang sakit. Okay. The next one is direct harm. Kasi kung meron ng mga gamot na sangkap na hindi naman dapat nandun. At ang pangatlo nga ay yung tinatawag natin na drug resistance, usually sa mga antibiotics yan. So pag namatay ang pasyente, sasabihin na, namatay siya kasi overwhelming infection. Pero ginamot mo eh. Dapat ang expectation mo, gagaling sila, di ba?
Fake medicines usually comes in with substandard packaging. It is fake when the ink on the foil or box easily fades and chips off. When the packaging is wet, markings easily fade as well. Users are also encouraged to check the color of the tablet. Solid substances are counterfeit if they easily get powdered or if they easily get dissolved upon intake without needing water. Fake suspension solutions usually coagulate instead of dissolving in water. In the country, the Pharmaceutical Security Institute says some fake drugs come from China and India. But Philippine health agencies admit they are having a hard time pinning down the sources of these counterfeit drugs, all the more that these are now also available online. They also admit that no local manufacturer has been apprehended so far.
Wala, ang karamihan are the products themselves. O dati kasi, I mentioned earlier na yung problema namin 15-20 years ago, yung gumagawa sa mga bahay-bahay. But mukhang wala na yun eh. Mukha yung finished product na yung nag-proliferate in the market. Actually, itong mga gamot na to, hindi namin alam kung saan nanggagaling.
So far, authorities say they are continuously monitoring drugstores and importation of drugs with the help of the Bureau of Customs. Those without permits from the FDA have not been allowed to penetrate the market. Authorities hope stricter penalties can be imposed as importers and distributors easily get away with it. While it may take time for intellectual property laws to be amended, consumers are advised to be vigilant. Manufacturers recommend that drugs should be purchased from licensed pharmacies. They urge the public to report any adverse effect of drugs they use to help save lives of other potential victims. Trisha Terada, 9 News.